Hello and welcome to this exercises to avoid video. In this video we're going to be looking at anterior pelvic tilt, what it is and what you shouldn't be doing with people if that is the case or the presentation they got. So anterior pelvic tilt, what does it look like? Well, if I'm going to stand side on, ideally we want our lower back, so this is our lower back and sacrum, is just in a position where it's positioned nicely with a slight tuck of the pelvis and it's over the heel. This is anatomically a nice postural position. Anterior pelvic tilt is just where the anterior, so the front of the pelvis, tilts forward, so it goes like that. So if you notice that somebody or one of your clients is like this, or from a side on it's very much like that, this is an exercise you definitely don't want to be doing with them. So it's also common that you see some form of rotation where some person has it's anteriorly tilted and rotated to the side like this. So one side seems normal, but when they go to the opposite side, that's rotated forward in that direction. Now, very simply, what we don't want to do, or what we want to ensure that we don't do, is we don't want to ingrain muscles or strengthen muscles which make this an easier process to occur. So in other words, the pelvis going like this in that direction. So one of the most common exercises which ingrains pelvic tilt or anterior pelvic tilt is a dumbbell or barbell RDL. And you think about it very simply, is that the pelvis goes backwards in that direction, but as we're going through like this, we're naturally extending and stabilizing using our lower back. So the muscles in the lower back are shortening and we go back in that direction here. Now once I'm here, yes, you may feel your hamstring stretch, but that is just because it hits in the max lengthening position. But what you do as you pull yourself back up is we compress through the lower back. So we compress using all these structures at the bottom. And the tighter these get and the better we get at putting our, shifting our hips backwards over the heels, the more we're ingraining this position which we stay in, which puts stress on the lower back and is going to get anatomical adaptations further up the chain in the neck and in the shoulders. So if you notice from a postural observation that somebody does flick the hips back and it's very forward like this, you don't want to be doing heavy RDLs with them in a bilateral stance. It doesn't mean that you shouldn't be hinging with them at all. It just means that we need to come up with variations and find out why the pelvis is anteriorly tilted in the first place. And that'll be an issue with spinal stabilization and foot mechanics as well. Finally, adding on to this is that another exercise to avoid when somebody has anterior pelvic tilt is heavy leg extensions. The reason for this is that we don't want to drive too much tension through the quads, so the rectus femoris muscle, which attaches through here and then into the quads, because what this does is it reinforces hip flexion, like so. So hip flexion, the leg coming up. So if you have somebody who's very anteriorly tilted and it is causing lower back pain or they have lower back irritation, take out dumbbell hinges, RDLs or straight leg deadlifts, and also make sure that you're not doing too many leg extensions where you're really enforcing a short position, because shortening of this muscle and reinforcing it isn't good. A very good alternative is just to flip it round and work on the hamstrings doing either lying Swiss ball leg curls or a seated leg curl machine.